Hello, welcome to Introduction to Statistics in Research. Statistics is a science that deals with the collection, compilation, analysis, interpretation, and presentation of numerical information. The application of the principles of statistics in medical research is known as biostatistics or medical statistics. There are so many uses of biostatistics. Biostatistics helps to compare the occurrence of a health problem in different populations. It helps to calculate rates, ratios, and proportions. Rate is the measurement of occurrence of some particular event which is related to health in a population during a given time period. We can calculate mortality rates or morbidity rates. Mortality rates are rates related to death due to some health events. Morbidity rates are related to morbidity or disease status. Ratio is a measure of disease frequency. It is different from rates in a way that numerator is not a component of the denominator. It expresses the relation in size between two random quantities. Doctor population ratio is the number of doctors in a geographic area divided by population size in that geographic area. Sex ratio is number of females divided by number of males. Next is proportion. Biostatistics help to calculate proportion. It indicates the relation in magnitude of a part of the population to the whole of the population. Numerator is always a part of the denominator. Proportion is always expressed in percentage. Proportion of female students in the class. How we can calculate? Number of female students divided by total number of students in the class multiplied by 100. Second and the most important use of biostatistics is in the field of medical research. It is in planning, conducting, analyzing, interpreting, and reporting of medical research. How it can help in planning? When you decide a research question or a research hypothesis, you have to justify why that research question is important. So we have to look for the various research evidence or literature available through literature search. After getting the research evidence, we have to critically evaluate the research evidence or literature. For critically evaluating or appraising the research evidence, we need the knowledge of biostatistics. Is the sample size enough? Is the statistical method used is robust? Is the study design good? All these we can get help with the knowledge of biostatistics. Second use is selection of appropriate study design. In coming lectures, we can discuss more on study design. If you are calculating the prevalence of a disease or health condition, you can use cross-sectional study design. If you are studying the association between a risk factor and outcome, you can use analytical study design. Analytical study designs can be case control, cohort, or ecological study design. If you are studying the effectiveness of an intervention to make a desirable change in a disease condition, then you can use experimental study design. Experimental study design can be clinical trials, randomized controlled trials, or quasi-experimental trials. Selection of appropriate sampling technique. Sampling technique can be random sampling or non-random sampling, like cluster sampling or purposive sampling, quota sampling, or convenience sampling. So selection of sampling technique also requires knowledge and application of biostatistics. Then comes calculation of sample size. How much sample is required? So you have to apply some formulas. Calculate sample size based on some formulas or softwares. For that we need knowledge of biostatistics principles, like what is a confidence interval, what is a confidence limits or precision, what is the power of the study, what is the prevalence, anticipated prevalence of condition based on previous research. All these values we need to apply while calculating the sample size. For conduction of study, you need to prepare a questionnaire or data collection tool. After preparing the data collection tool, you need to validate it. What is validation? Your questionnaire should be able to measure what you are supposed to measure based on your research question. So validation of questionnaire, reliability of questionnaire, all these you have to apply biostatistics principles. Calculation of measure of central values like mean, median or mode. Then calculation of measure of dispersion of data like range, variance, standard deviation, interquartile range. And you have to check if your data is normally distributed or not. Test of normality should be applied. For these all, we require biostatistics principles. After collection of data, you will be describing the data using measure of central tendency, measure of dispersion, and test of normality. After that, you have to present the data as tables and diagrams. For that also, you require biostatistics principles. Then last part is the analysis of data. You need to apply some statistical tests to know if the association between different variables are statistically significant, or if the difference between various groups, difference in occurrence of disease or difference in occurrence of a health related problem in different groups is statistically significant or not. You have to apply inferential statistics to analyze the data. So in coming lectures, we will learn more about descriptive statistics and inferential statistics. Thank you.